So welcome back to Coach's Corner, and I'm with Louise Pitt, and this is all about hearing from professionals in the industry who are nailing it. So Lou definitely is. Can you introduce yourself, Lou, and tell us a little bit about your profession?
Hi, yes, I'm Louise. Nice to speak to you, Rach. I'm a complementary therapist background. So I did a degree in complementary therapies a few years ago. So I graduated in 2010. And since then, I've been on a journey of completing further training through sports, massage, sports and activities, kind of my passion, and movement is kind of what I really love, and love keeping people active. But I found that a lot of the qualifications that I'd done weren't really achieving the results that I wanted, which kind of led me then to biomechanics, because I wanted to get people off the couch more. So I'm not just doing hands-on treatment, but looking more at the whole body and how it moves and how to get them more active and stronger and performing better. And so that's kind of that's where I'm at.
But how did you first get in the industry, Lou? What was the very first step for you? You know, I don't know how long it was ago when you first started out, but when was that, and what was it you first did in training?
So the very first course that I did was a level 3 diploma in aromatherapy in a further education college. So my interest was more in my kind of teens, was in physio. And then kind of later on, I was more interested in the hands-on manual therapy. But I wasn't sure whether I would be that interested in really touching people. So I thought I'll do a year's course, something relatively cheap, see how I get on. But literally just fell in love with alternative therapies and then went from there, really.
So you came into the industry from a kind of a different angle for a lot of people, and you've done sports massage. What else have you got along? Did you do personal training or?
No, it's all therapy based. So I did body massage, advanced massage, which is osteopathic background, reflexology, clinical aromatherapy, and sports massage.
What do you think then triggered you to do our diploma then, if you're coming from that kind of area? What was it that sort of drew you in, if you like, to the Biomechanics coach diploma?
I think even though they're quite high level qualifications, a lot of the time the specifications and the quality of the training varies, and there was still a lot of things that I felt were missing for me as a therapist. And I think to be really holistic, it's not just, you know, if I'm going to look at the physical body in depth, I need to understand movement a lot better, and you don't really get that kind of training. So that's what led me kind of into this direction, really.
And who would you say is your kind of typical demographic that you get, or your preferred demographic? Who are you kind of like mainly looking at?
So definitely sports people. I'm currently based in a CrossFit box, so I'm working a lot with weightlifters and kind of ex-athletes and sports. So that's where my passion is, really. I love taking part in sport and having challenges. So yeah, that's where I'm at.
And do you think they're open to sort of your kind of holistic-y, kind of like, you know, the approach you come from originally with the aromatherapy, or do you hit it with the sort of exercise and manual therapy side? Is that more what attracts those guys in?
Definitely a combination of the manual therapy and the exercise, but there is a massive interest in kind of the psychological aspect within sport. And, you know, we talk a lot about pain and psychological effects on pain and pain perception. And a lot of the guys that I work with really enjoy an adapted treatment. So it's not just kind of deep tissue and painful. It's adapted and tailored and kind of treats them more holistically. And I think it's taking off and growing in a bigger way, definitely.
Sounds brilliant. And I guess sort of that demographic are, you know, particularly with the CrossFit sort of area, they're definitely in need of some kind of therapy or exercise program that helps them move better, right?
Definitely. And all elite kind of athletes, everyone has a therapist as part of their training plan. So for me, it's not just about good movement either. It's about getting the quality rest and recuperation that you need so that you can perform well. So the holistic treatment side of it helps in that respect as well. So
I'm sure that's a bit of a challenge with those guys, isn't it, to get them to take a day off, is it? Or are they quite good at
that? Sometimes I'm trying.
And do you think, because I know, certainly for me, and I spoke to Louise earlier, do people have misconceptions about biomechanics, or what are people, how do they receive it when you say you're doing a biomechanics coaching diploma? What's the question?
Yeah, I think most people ask what it is, because as soon as you mention biomechanics, a lot of kind of day-to-day people not within kind of therapy industry don't understand what it is. So even if I describe it as screening, they don't really understand what it is. So I'm always having to explain and educate.
And what sort of things do you say when you're explaining it? How do you describe it? I'm sure you've got a plethora of kind of paraphrase, phrases or whatever that you use, or paragraphs that you use, but what's the most common way you describe it?
So I always describe it as body screening, and then I just explain that it's a series of tests and analysis of movement, looking at pelvis, spine, shoulders, knees and feet, just to see how, even though they're moving really well, where there could be areas that could be moving even better, and then to look at ways of adapting that and improving on it. It's pretty much it, really.
Do you think, from sort of your background, the professionals in your kind of area, are they making common mistakes when it comes to biomechanics and posture, do you think?
I would think that the biggest mistake is having a standard and expecting everyone to be at that same standard.
Yeah.
I think posture can be, it's like a lot of research. You always have a standard, but I think you've got to look at the individual, and one person's posture might be right for them, but not necessarily for the next person. So it's always being holistic. You've got to look at that person and tailor it to each person. And I think that's the mistake a lot of people don't.
Yeah, and I guess any system in relation to the body is going to be flawed to some degree, because you're trying to match people to measurements and standards that are based on averages, which not all of us are. So
yeah,
when you think of how we look at it compared to, say, postural assessment, what do you think the biggest difference is in terms of application or understanding application, maybe?
In compared to postural assessment?
Yeah.
I think postural assessment is quite static, whereas we're actually looking at functional movement. You're looking at, it's broken down more, so you're not just looking at one big picture, you're looking at every little individual part of that picture, which builds a stronger foundation, I think, that you can build from and adapt from, rather than just, I think with postural assessment, sometimes it's a little bit too rigid. Does that make sense?
Yeah, but possibly subjective or a bit vague, because you're looking at the bigger picture, aren't you? So
yeah.
Is that elevated shoulder because of the upper trap, or the QL on the opposite side, leaning the spine, laterally flexing the spine, I guess. But it's because it's an holistic view of the body in some ways on a test measure. I guess that can leave you in confusion as to what's actually causing what you're looking at. But we break it down, don't we? We break it down.
We break it down.
So if you, have you got a sort of, I don't know, a client that you remember and you think that was amazing, or, can you share, maybe without obviously giving any personal details, a sort of an example of how it's helped one of your clients specifically, maybe one of the CrossFitters, I don't know.
Oh, I've got loads.
Really? Oh, brilliant. Well, do you want to give a couple that are kind of like different to each other, but maybe a really good one?
There's, who can I go with? Who's the most interesting? So there was one lady actually who does CrossFit. She's a masters competitor now. She loves CrossFit, and was getting a lot of issues with her squat. She had leg length discrepancy. She had a lot of hip pain, knee pain, lots and lots of different problems. And she'd been to all kinds of different therapists, podiatrists, physios, gynae physios, lots of different people. and getting different advice, doing what they were advising, not getting any results. And literally, and no lie, after the very first session, I think we did something like forcine, which was one of the pelvic antispasms, and she squat as to grass, and within 3 to 4 weeks she was doing recurring WODs, so workouts daily. She was recovering quicker, her form was better, she was pain free, and now I think we're about 9 weeks, 10 weeks in, and just everything for her has improved. So a lot of the CrossFit movements like wall balls, squats, lifts, her lifts have increased. Her balance has improved, so she can improve on her pistol. Wow. There's loads. I could go on and on. It's incredible.
And that's in 9 weeks of seeing you. That's, you know, just over a couple of months. I mean, that's phenomenal.
And that's just through doing biomechanics screening and then doing the exercises based around what you've taught us to do.
Yeah, yeah. Did you use manual therapy with her as well?
We've done 2 manual therapy sessions, and I did do a little bit of NKT muscle testing on her as well. That did help with some of the core engaging stuff. So other than that, it's just all been biomechanics.
Amazing. Get her on your Facebook page.
Yeah. Well, it was fab.
Yeah. Anybody sort of different to her, you know, like the other end of the scale? Anything quite different in terms of clients that's, you know, you've got a result from?
Who else is there? There was a lady that was a horse rider.
Yeah.
She had to stop horse riding because it was making creating some imbalance in her horse, but she was having a lot of pain. Again, she'd been having chiropractic treatment and it wasn't having any effect. She was going every 4 weeks. We did 1 full body screen. She went away, did the exercises for a week, and again, pain free, movement improved, core ratio improved, and that was just within 1 week.
Wow.
So, and obviously that's going to make a difference to her horse as well. So the horse isn't adapting to her biomechanics. Yeah. So, yeah.
Amazing. Amazing. In such a short amount of time as well. What do you think for you, Lou, would be, I don't know, the best thing coming through the academy? What's your favourite thing of coming through the academy, starting with us, coming out the other end? You're just in your case study phase at the moment, aren't you?
Yeah, that's right. It's difficult to pick one.
You can listen if you like.
Well, first of all, the community, because it is exactly what you sold to me in the beginning, that it is a very supportive community, and you can literally go online, ask a question, or even with yourself and some of the other guys, it's never too much trouble. There's always somebody with a really useful, informative answer, and they are really supportive, and that is genuine. So that's probably right up top for me. That's kind of lived up to my expectation. What else? Obviously, new skills.
So can I touch on that testimonial that you sent to us as well? Because I remember when you came through at the beginning and you were, you clearly knew what you were doing in terms of your previous training, but you were almost slightly deer in headlights in terms of your business, because you like to travel, don't you? So you like to kind of go, you know, overseas, and so
I like an adventure.
Yeah. But I think for you the challenge was commercially what you were going to do with your business, isn't that right? And then you kind of got there now. Do you mind telling us a little bit about that?
Okay, so when I came and started with yourself, I'd been in business for 2 years and it was doing all right. It was kind of going in the right direction, but I don't know, I think you hit a bit of a dip and you're on your own, you're quite isolated and you're not quite sure what to do next. And then I was going on really interesting breaks and challenges, and yeah, I kind of, like you said, I was a little bit deer in the headlights, didn't know which direction to go in. And I was kind of considering whether to give it all up altogether and just go and travel. And then you introduced me to Chris, which was, that was a life-changing moment.
I think you're a dream client for him, actually, to be honest. So, we're talking about Chris Wright, guys. You can find him on Facebook, Chris Wright HQ. He's our resident guru and advisor to all biomechanics coaches on all things sales and marketing in terms of business, social media, all the techie stuff, which many of us are not that good at, are we? So, but he's been supporting you, hasn't he? Tell us a bit more about that.
He has. So we had our initial chat, which was free, and he gave me some great advice within that talk. To be honest, it was for an hour, and we had a brilliant advice, which I put in place, and straight away had great success with sales and things. And then I signed up, and basically, yeah, he's just been advising me ever since. So anything business related, marketing related. So within 2 months, I've doubled the monthly income, started to expand the business. I'm now hiring.
I saw that.
And planning the future, which is looking really, really interesting at the moment. So it's totally turned things around, got me motivated again, got me excited about the work again. His knowledge is just amazing. In the beginning, there were a few clashes. He would suggest a few things, and I was like, no, don't agree, can't do that. But actually, I thought maybe I should just listen and put it into practice, see what happens. And actually, yeah, it's worked out for the best. So
yeah, he's great.
Highly recommend Chris.
So, I mean, it just highlights, like you say, that the academy is just more than just coming on a workshop or getting a certificate. We're all, as a community, helping each other, whether it's from business or you can speak to podiatrists, physios, personal trainers, doesn't matter your remit. It's about appropriate duty of care, but also feeling successful in your business. I think people are a bit uncomfortable talking about money or wanting to earn more, and yet we all want to be financially free at some point, even if we love our jobs, which you and I clearly do. You know, you've reignited your passion. You know, I love what I do all the time, but ultimately it is about, you've still got to pay bills, you still want to be, you know, financially free. And I think as a nation, I think we're a bit awkward about talking money. Chris doesn't have a problem with that at all, and he doesn't have a problem with helping others to do the same. So you can definitely find him. So just get in touch. We can point in his direction. So just to sort of come round to a close before I let you tell people where they can find you. If somebody listening was thinking about joining the academy, what would you say to them right now?
Do it. Just do it. Just sign up. At the end of the day, you have choices, and you've just got to act on it. You've just got to sign up and do it.
Yeah.
And they're not going to regret it, because they're going to learn so much. So much.
Yeah. Thank you for that, Lou. So if anybody listening wants to come and see you, maybe if they're a CrossFitter or a horse rider, whereabouts are you based?
I'm based in Celtic CrossFit in Newport, South Wales.
Newport, South Wales. And we've got you, we're going to be putting you onto our website as soon as you've qualified, so you'll be a registered biomechanics coach. But at the moment, have you got a website or somewhere they can go and find you, or social media somewhere? Do you want to tell the guys?
I'm on social media, so I'm on Instagram as Therapy by Lou, and I'm also on Facebook under Complementary Therapies by Louise. My website is still in kind of a design phase, so it will be ready soon. Brilliant.
Lou, thank you so much for your time. Much appreciated. Am I going to be seeing you in a couple of weeks at the workshop down in London, or are you not at that one? We've got one of these IBA Discovery Days coming up. I don't know if you're going to be at that one. I was going to meet quite a few guys there.
There's a September IBA Day, I think, which I'm going to be at. Yeah. But I don't remember what the content is, I'm afraid.
Well, we've got, it's a gathering of biomechanics coaches, both learners and qualified. And this is this community that we get together 4 or 5 times a year. And that's one of those days. So it is part of the IBA, or the Intrinsic Biomechanics Association. It is open to everybody, not just biomechanics coaches. So that's a 10 till 4 day. If you're a member, it's free. If you're not, you just pay a small admin fee. You can find that on the website. But that is on the 15th. And that will be myself, and we've also got Mike Grice, who is an osteopath. He's going to be coming along and doing a mini workshop on therapy. And I think it's to do with lumbopelvic area. So anybody listening who wants to join us, just get in touch. You can find me at Rachel at biomechanics.education.com, or on the website biomechanics.education.com. Lou, thank you so much for your time. I will see you then in a couple of Saturdays from now, and we can catch up then.
Fab. Thank you very much.
Thank you.